Welcome to On The Beat, everyone. I'm Troy Thompson. Joining me today is Amanda from Omnis Health Clinic. And today we're talking all about obstructive sleep apnea. Welcome to the show, my friend.
Thank you.
Okay, is sleep apnea and obstructive sleep apnea the same thing?
Pretty much, yes.
What is it?
Sleep apnea or obstructive sleep apnea is when the airway collapses while you're sleeping and it prevents you from taking air in to your lungs.
Which is very bad. Is it something that can kill you while you're asleep if it's a serious enough case, or you sort of wake yourself up from gagging or lack of air?
Most people wake themselves up even hundreds of times a night. It could, in theory, kill you if your airway stays collapsed or obstructed for long enough.
Well, what causes sleep apnea for everyone at home who may think they may have it?
Well, there's a couple different main things, and that can be there's some genetic things where people have some central apnea initially. People with large necks, weight gain can contribute.
I've never heard of large neck syndrome.
I don't think it's a syndrome.
No, it's not.
Just some people naturally have a bigger neck than others.
But also overweight, obesity is a major cause.
It is a major contributor.
Diet and exercise can be helping all of these things as well.
Well, it can certainly help you lose weight, but it will not prevent those muscles from completely relaxing and blocking off that airway.
Okay, well now you've just said that, I want to ask you a couple of questions.
Okay.
Non-surgical ways to fix this, or is there only surgery?
No, there's surgical ways to fix it, a few different surgical ways. But one of the main ways to fix obstructive sleep apnea is by using a CPAP machine.
Of course, I forgot about the CPAP machine.
Right.
Do you think that you should always go and have a sleep study before doing anything serious when it comes to surgery?
If you have some of the symptoms of sleep apnea, like unrestorative sleep, or when you still are sleepy when you wake up in the morning, choking or gasping like you mentioned during the night, witnessed apneas, when your wife or husband say you quit breathing for several seconds at night.
Well, that's what I was about to say to you. For someone like me who lives alone, how do I know if I'm choking? Do you know what I mean? Like, or how do I know I'm not breathing? That's the problem.
You wouldn't if you live by yourself, but if you have some of those other symptoms, like feeling really tired even when you wake up and you feel like you slept, or knowing that you wake up a lot during the night. Yeah.
What do you think? I've been getting a lot of information in regards to these little apps that you have on your telephone now, that you can put beside your bed, and it can record snoring or movements or dreams and things like that. What do you think of things like that for people who do live alone?
Well, they can be helpful to maybe clue you in to the fact that you might need to go to a medical professional to have it checked out or just investigated.
Are those sleep apnea products that you're talking about, CPAC and things like that, are they under your insurance if you're needing something like that?
Yes.
You need to check your insurance company, right?
Well, most insurance companies cover those types of interventions for sleep apnea because sleep apnea can be so devastating.
How serious is this in America?
It's very serious. There's a lot of people with sleep apnea that is undiagnosed and not treated. Even when it's diagnosed, people maybe don't get treatment like they need to. And there's a big recall on CPAP machines right now as well. So
we need to check out all the things that are out there to begin with.
Yes.
We thank you, Amanda.
Thank you.
If you want to find out more information about sleep apnea or obstructive sleep, give Amanda a call from Omnis Health Clinic. Back after this short break.